What is the transcutaneous approach in lower eyelid surgery? Imagine a procedure that allows surgeons to access the tissues beneath your lower eyelid through a small external cut. That's essentially what the transcutaneous approach in lower eyelid surgery involves. It is one of the main techniques used in eyelid surgery, known as Blepharoplasty, to improve the appearance of the lower eyelids. This method involves making an incision on the outside of the eyelid, usually along the lower lash line or just below it. The goal is to follow the natural skin creases so that scars become less noticeable over time. Once the incision is made, the surgeon can carefully lift the skin to reach the underlying structures. This approach provides direct access to the orbital fat pads, which are fat deposits that can cause puffiness or hollows under the eyes. The surgeon can remove or reposition these fat pads to create a smoother, more youthful look. The transcutaneous method also allows for dissection through the orbicularis muscle, the muscle that surrounds the eye, and the orbital septum, a fibrous membrane that separates the eyelid from the eye socket. This dissection is essential for addressing excess fat and skin, especially in cases where there is significant skin redundancy. There are different variations of the transcutaneous approach. The most common is the subciliary approach, where the incision is made just below the eyelashes. This provides excellent access but carries a slightly higher risk of complications like ectropion, which is when the eyelid turns outward. Another less common variation is the infraorbital approach, where the incision is made below the orbital rim. However, this approach is less favored today because it can leave more visible scars and has a higher chance of complications. The benefits of the transcutaneous approach include the ability to remove excess fat and skin simultaneously, making it suitable for patients with both puffiness and sagging skin. It also offers direct access to deeper structures, which can be helpful in complex cases. However, it does come with some risks. Because of the external incision, there is a higher chance of visible scarring and complications like ectropion compared to the transconjunctival approach, which involves an internal incision inside the eyelid. Sometimes additional procedures, such as a lateral tarsal strip, are needed to stabilize the eyelid and prevent malposition. In facial aesthetic procedures, the transcutaneous approach is often chosen when there is a significant amount of excess skin or when skin tightening is desired. Despite its advantages, many surgeons now prefer the transconjunctival approach for patients who do not have excess skin, as it tends to have fewer complications and no visible scars. The decision between these techniques depends on the individual's specific needs and the surgeon's experience. If you are considering lower eyelid surgery, it's important to consult with a qualified plastic or oculoplastic surgeon who can evaluate your unique anatomy and recommend the most appropriate approach for you. Always remember that every person's anatomy and goals are different, so personalized medical advice is essential for safe and effective results.